And I have the pleasure of introducing Tracey Seipel. She's the Managing Director of the Seipel Group. And today her presentation is Bladder Control, an emerging priority in aging populations.
Thank you, everyone. I've been working in the area of bladder control for the past almost 20 years. My background is as a naturopathic doctor, herbalist, clinical nutritionist, and I identified back in the late 90s that bladder control issues were this emerging priorities. There was actually a survey they did of Australian women. It was just done through a magazine, but it was the largest selling magazine for women in Australia. And what they showed was in the top 5 health concerns that bladder control and urinary incontinence was the third major concern for Australian women. Now, I knew I could treat this, and I really had no idea of how big a problem it was. So I developed the first formula in 1999. We launched that in the USA in 2002, where we were very well accepted. In 2006, I won a Nutrition Business Journal Award because they saw I had actually opened a new category for bladder control, and they saw the size of the market as well. We've continued to research and we've improved the formula since back in 1999, and our current formula, Urox, the results we were getting at 3 months, we can now achieve those at 1 month, so we're getting a much better result. So now we really, up to this point, have really just sold in Australia and the US, so now we're looking at moving into other countries as well. Just to give you a little bit of an idea about bladder weakness, for those of you that are not aware how big a problem it is, originally the formula was developed for urinary incontinence because that's what this survey had shown, that there was a big gap in the market. Incontinence is where you lose urine involuntarily, you have accidents, you wet yourself basically. And women, there are 2 major types, stress incontinence and urge incontinence. So women have more stress incontinence, where stress is placed on the pelvic floor, and if they jump, laugh, cough, sneeze, they don't get any warning and lose urine. 1 in 3 women who've had a child will have stress incontinence, but also people with lower back misalignments or obesity or chronic constipation. So it's not just women, men are affected too, but mainly women. In 2002, overactive bladder, the International Continence Society coined the term overactive bladder because it was a syndrome and this set of symptoms where people have urgency, that they have to rush to the bathroom, and if they don't get there in time, they have an accident or urge incontinence. So the 2 major types of incontinence are stress and urge, or mixed. They have a combination of both. So overactive bladder people have urgency, where they have to rush to the bathroom frequently throughout the day. They'll go more than 8 times in a 24-hour period, and they'll get out of bed at night to go to the toilet. And you might think this is just affecting a few people. It actually affects 1 in 5 people over the 18, or 17% of men and women over the age of 18, and the incidence increases with age. I've got US figures, so I hope you'll bear with me, but in the US population, 50 million Americans have bladder weakness, either overactive bladder or urinary incontinence, and currently their only options available for them are pads, drugs with intolerable side effects, or just putting up with it. So they really don't have anything to help them. I've got here who is affected. It depends which way you look at it. Because people are embarrassed about bladder problems, they don't talk about it. So the research shows less than half of people tell their doctor or even their husband or wife. They just don't talk about it. So every time you look at the statistics, it goes up, and it's going up more than one would expect, but that's just because it's getting better reporting and they're getting better statistics. So this is the National Association for Continence in the US, and basically, it's half of people over the age of 50, and it just increases from there. And this really significantly impairs quality of life. So we did focus groups in the US on the east and west coasts, and to give you an idea of the impact, people with bladder problems, they wear black because you can't see the urine stains. They're worried about odour. They don't like to stay overnight at someone's house because you're up all the time for the toilet. They actually stop like falls at night and hip fractures, you can correlate those with the elderly with actually getting up to go to the bathroom in the evening. They won't travel for more than an hour away from their home because that's as long as their pad can last. So they suddenly become very reclusive, and it's actually one of the leading causes for admittance to nursing homes in the elderly, at least in the West, that is, where we seem to send our elderly off to nursing homes, unfortunately. So in the US, you can see here, the US alone, it's about $20 billion a year is spent on just urinary incontinence. So it's quite a lot. And in the US, on diapers, drugs and supplements, it's $12 billion annually is spent. So there's a lot of cost for nursing care and washing and all of these sorts of things as well. So it sounds like we need a product for this. Just looking at this, the market segmentation, most people actually use adult diapers. 3/4 of people will use adult diapers. Just under a quarter will use pharmaceutical medications, but there's a lot of room for some sort of natural treatment. I've been talking all day. So the diapers, if you have a look at the economics of it, the adult diaper or pad industry is the fastest growing household products business. It's growing at an exponential rate, and that's because we're in an ageing population, and those people have urinary incontinence, so they need to address that. From a shelf space perspective, they're so bulky, they take up so much room as well. So from a commercial perspective, they take up too much space in the store. And also from an environmental perspective, they're the third biggest landfill issue globally after tyres and chemicals. So there are more reasons we need to address that. The drug medications for urinary incontinence and overactive bladder are largely anticholinergic, antimuscarinic drugs. So what they do is they have the unfortunate side effect of dryness. So people get dry eyes, dry mouth, dry vagina. If you're prone to cold sores, your mouth's so dry that you start to break out. They also know they cause memory loss, but the JAMA, the Journal of the American Medical Association, a couple of years ago, their front page article was that these drugs actually give you permanent memory loss. So the incidence of dementia and Alzheimer's increases with the use of these medications as well. So if we can find something that works on a different mechanism of action, that would be good as well. Again, just looking at these were the sort of areas we were looking at. So the accidents, the incontinence, the urgency, having to rush to the bathroom, going to the bathroom more than 8 times in a 24-hour period, the nocturia, getting out of bed at night, and bedwetting. Here as well, probably only 30% of sufferers have been diagnosed, they estimate. So a lot don't report it, but then a lot just don't seek treatment as well. So what I want to talk today is our latest research. We actually started our research on the bladder control. We did pilot trials which were published in the Australian Continence Journal, and then we did a randomised control trial with 150 participants when we had just 2 herbs, the Creativa and horsetail. That was conducted in the US, and then we've improved the formula and added a 3rd herb. The results we got at 3 months, we can now get at 1 month, and we've just finished, and it's about to be published, our 150 participant randomised control trial on that formula. The herbs, just a little bit about the herbs. Creativa nivala is an Ayurvedic herb. It's very well documented in Ayurvedic traditional pharmacopoeias for a range of urinary disorders, but also incontinence and bladder control. There's a lot of research with Creativa and the lupiol, the active constituent for kidney stones. It's very good, especially calcium oxalate kidney stones, in preventing and treating those. Horsetail, there's early research with dogs where they show 40 days use of Creativa, they can increase the bladder muscle tone of dogs, and our product actually works in animals, in dogs as well. Horsetail is very high in silica, and horsetail is often given the silica is very good for connective tissue, collagen and connective tissue. So hair, skin and nail formulas use equisetum or horsetail, but the horsetail helps with the connective tissue structure and tone of the bladder and pelvic floor and the tissues, and it's again documented in traditional herbal pharmacopoeias for urinary incontinence. And then Lindera is the 3rd herb. It's a Japanese and Chinese herb for kidney yang energy, yang deficiency. again, documented traditionally for incontinence, and research even shows it delays the progression of diabetic nephropathy, which is good to know for longer term use. These are some of the institutions where we've conducted our research. So I just wanted to share with you the results of our latest trial, which I expect in the next few weeks. We've been told they've approved it for publication, so it just has to come out. So we looked at 150 people, and these were the 4 symptoms, and they had to have at least 2 of those symptoms. So it's a holistic formula. We didn't want to just target it for one symptom. We were just looking at, usually people with bladder control issues have a variety of symptoms, so they were allowed to have a variety of symptoms in the trial, but then we segmented each of the symptoms when we were doing the statistical analysis. So 8 times a day or less is normal for day frequency, so 10 or more were included. Nocturia, getting out of bed once at night, is still considered normal, so 2 or more they were included. The urgency, they shouldn't have any urgency and incontinence, so more than 2 a day, and they were included in the trial. So they weren't extreme cases. We were trying to get an average population sort of picture here, and they had to have them for at least 6 months, and then they were given either the dummy placebo or the active Urox capsule. I won't talk through this, but this just shows, some had 4 symptoms, some 3, and otherwise they had to have 2 symptoms to be included, and they were sort of roughly equal men and women in the trial. And these were the results. So you can see here, this is the dummy or the placebo, which stayed roughly the same, and this is the active or the Urox. So we had consistent reductions, and at 4 and 8 weeks, statistically significant results, and less than 8 is considered normal. So the total average day frequency was normalised by 8 weeks of use. This is the night frequency, so they went from, actually that should be 4.1 down to just over 2. So we roughly halved the getting out of bed at night, which still they were getting up. We actually find if they go for 3 months, they actually get an even better result. But if you imagine getting up 4 times to 2 times, your energy is going to be a lot better in the day. You're going to feel much more recuperated. This was urinary urgency, so we went from close to a 4 down to a 1, so just once a day they were rushing to the bathroom. And then the urge incontinence, which is with the overactive bladder, and this is stress incontinence, which is more women post-childbirth, where they don't get the warning. So basically we saw pretty good results across all of the symptoms we tested. As far as how the product's working, we know the earlier testing, they showed it helps with improving the bladder muscle tone. We think it also helps just the functioning of the bladder muscle to relax. So if you imagine if the bladder muscles are tight and rigid, they can't expand and fill and contract and empty. So we believe it's actually helping the bladder properly fill and then properly empty, and a tonic effect on those tissues as well. And we didn't have any anticholinergic or antimuscarinic side effects, and we don't anecdotally either. So it's not working on that drying mechanism, which is good. These were the study adverse events, so you see it pretty much was no more than placebo. In fact, placebo had a few more. The UTIs with these sorts of symptoms, they're quite often prone to UTIs, so if they have chronic UTIs they weren't included, but generally they probably have more UTIs than the average population. We also did, I've got some figures here for post-market adverse event reporting. So as a regulatory requirement, we have to document all reported adverse events, and we're looking at on a base of just these direct customers over this period, so 160,000 just under users, and we had less than 0.07% reporting adverse side effects, so that is matching with what we found in the research. And the symptoms were, it either didn't work or they said it made it a bit worse, or their bladder symptoms or digestive complaints, like they felt a bit queasy or diarrhea, constipation, or we had some allergic reactions. There was no full anaphylactic shock, but we did have like some with hives, with swelling, so they're obviously intolerant to something in the formula. If people are allergic to grasses, sometimes they'll react to horsetail because it is a grass as well. So that maybe is what's happening there. And there were no reports of any interference with drug medications over that period. We also had, on the earlier formula, just the Creativa and horsetail, we had conducted cytochrome P450 enzymes are enzymes that metabolise most of your drugs. So what we do is we test those enzymes and see if the herbs act on those enzymes, because if they do, then probably they're going to interfere, either speed up or slow down the drug metabolism. So just on those two herbs, we showed also earlier no interference with the P450 enzymes. So basically that indicates it's likely safe as well with other medications. And that was published, that research. So basically, to sum up the bladder aspect is, people have these adult diapers, which I don't think should be the answer. It's really just a Band-Aid solution. There are the pharmaceutical drugs, but the side effects, half of the people or almost half have to stop them within 2 months because of the side effects. And the data shows about 14% of people become continent with those, so it's not a success for everybody. And the recommendation is, the permanent memory loss is unacceptable. And it seems, at least in the Western literature out there, that people are looking, they were willing to try a herbal or a natural approach, and 75% have tried something. They mustn't have tried ours, but they've tried something. But, there's not a lot of research out there. I've just done a bit of a comparison as well. This is Urox, and there's also soy and pumpkin seed is another herbal product out there for bladder control, and Archangelica. They're the only ones with randomised placebo-controlled research, and you can see they've had these ones have had a higher dropout than ours. Urox is the only one with men and women. These were just women and men. And then we had a greater reduction in frequency, nocturia, the urgency, and we were the only formula that actually reduced urinary incontinence, according to the research. In fact, the Archangelica really showed, I think they say it's the #1 selling in Europe, but their research shows it doesn't work for urinary incontinence or the nocturia, but there's a trend towards improving sleep. So this is the retail price in the US and Australia, roughly $40 a month. And if you have a look, pads, like most people will reduce and often come off their pads with them. But, we're looking more even just for the quality of life effects with that as well. I did just want to touch on, because we look at other areas in the bladder category, and just male lower urinary tract symptoms, or LUTs as we call them. So LUTs are pretty much, there are 3 categories they look at. You have a storage problem where the bladder can't hold the urine properly, an emptying problem where the bladder can't get the urine out, or painful symptoms, which is very rare. So storage problems are where you get the urgency, the frequency, and the incontinence, and they're due to overactive bladder. Whereas emptying problems are largely benign prostatic hyperplasia is one of the, for men, older men would be the main reason. And that's where the prostate, which sits just underneath and behind the bladder a little bit, as it gets larger, it actually starts to constrict the urethra, or the urine outflow tube. So it means the flow is weaker. Men have to push very hard, which then causes secondary bladder problems, like the muscles in the neck get tight. If you're sitting at your computer all day, the bladder muscles get tight and quite rigid, and then can't relax and fill and contract and empty. Male LUTs are not just due to BPH, and that's really what everybody out there is treating from a retail public, self-prescribing approach. I mean, of course, doctors and specialists would be focusing and treating appropriately, but there are all these prostate formulas out there, but they're only treating this section. You've then got all the men with overactive bladder, and that's the reason for their lower urinary tract symptoms. And they're the men who don't respond to the saw palmettos and the pumpkin seeds and all the treatments that they use for prostate. So what we've done with our Prorox is we've actually combined Urox with the clinically proven prostate improving herbs, and so we're, rather than just approaching half the story, it's a much more comprehensive way to treat male lower urinary symptoms, and men who don't get effects on just the straight saw palmetto or other prostate formulas will get results on that formula. So it supports the prostate and the bladder, and these are just some of the straight results just using the Urox. So reduces nocturia better than the Urox alone. This is the total international prostate symptom score. So they go from a high, moderate to low on that. And the urinary frequency, again, we got them within below 8 within 2 months of use. And just to finish up, our formula, over the years, we've had a lot of people saying, can I use this in my child for bedwetting? And yes, they can. So we know anecdotally it works. We've had a lot of people using it. And what we do now is we've just brought out a dedicated product for bedwetting with the appropriate dosage for children. So children up to the age of 5, it takes a while for the neural pathways to the bladder to establish and for the bladder to properly communicate. So below 5, it's sort of normal for a child to have bedwetting. But if they're continuing beyond 5, really that's sort of an issue that you might want to address. Currently, probably the standard treatment for children is nasal spray of antidiuretic hormones, so they don't produce the urine overnight. But what the Urox for children does is it helps just increase the tone of the bladder muscle, and we find people with multiple sclerosis respond quite well for the bladder to our formula. So maybe it's helping just establish that communication between the bladder and the brain a bit faster as well. These are just some statistics of children who wet the bed, and again, if it's something that's never affected you or your family, it's not an issue, but we have children 9, 10, 12, 14, 15 who are still wetting the bed, and it's very embarrassing. It affects their confidence. So there is something they can do about it. That's a sort of a natural, well-tolerated treatment that's not going to produce side effects, but just helps them establish that. And that's the bedtime buddy. And they're the dosage. So the time frame for bedtime buddy is usually within 2 to 4 weeks they get a good result, but they probably need to continue for a few months on it before they wean down off it. So 6 to 9 months is the usual treatment time frame for that. So that's all I wanted to talk about. And my children say, "Mum, are you the bladder queen?" Because my world is bladder. But it's just something I've been quite passionate about, and it's something nobody else has been addressing, that we can have all of these natural solutions that are at least as effective as other alternatives out there without the side effects. So we're at stand C20 if you want to discuss that, or but I think it's a good viable option. So thank you for coming.